Good morning and welcome to Breakfast with Charlie States and Nina Warhurst. Well, we return to our top story now and the government's announcement of new tests that can detect coronavirus within 90 minutes being rolled out at care homes from next week.
The innovation was hailed as a lifesaver by the Health Secretary Matt Hancock. Let's get a view from Professor Tom Solomon, who's Director of the UK's Research Unit in Emerging Infections at the University of Liverpool. Very good morning to you, Tom. So can you just, for everyone who's hearing this for the first time, can you describe what this test is, the 90-minute test? What is the procedure? How does it work in practice?
The test is going to be similar to the test we've had already. It's detecting the virus's nucleic acid, but whereas in the past tests have had to be done by a swab, and that has to be sent to a laboratory, what we now have is a test which can be done in the place where the sample is being taken. And also the other new change is it's not just done with a nose swab, but it can be done based on saliva as well. So the sample will be taken, it will be tested locally where it's taken using a piece of kit. There are a couple of different kits or equipment that's going to be used. One is a little handheld, the other is more of a laptop size, and that will tell within 90 minutes whether the patient has SARS-CoV-2, the virus that causes COVID-19. And also importantly, it's testing for other viruses, which we know we're going to see more of as the winter comes, such as the flu viruses.
So two key elements by the sounds of what you're saying. One is the speed at which the results are known. The other is, by the sounds of it, the practicality, the portability of the system.
Yes, because currently what happens is when a test is taken, it has to be sent to a laboratory, and that takes 24, 48 hours to get a result. And clearly having a result available within 90 minutes is going to make a big difference.
Now, we understand that this is to be rolled out from next week. Now, when you hear that phrase and you hear about the numbers that they're talking about, what difference do you think this can make? In what circumstance is this most useful?
Well, as I understand it, there's going to be 500,000 tests available from next week, and it's going to be used in care homes and then also in hospital settings. But potentially, we've talked the last couple of weeks about quarantine of returning travellers, etc., and an alternative approach, which is to test travellers when they come back, perhaps test them on arrival and then test them again a few days later. And this kind of rapid testing, which just can be done by anybody. You don't need any medical or scientific training. You need very basic training just to take the sample and put the cartridge in the kit. This kind of thing might be able to be used in places like airports, again, which will make a big difference.
Talk us through how this might work in care homes, for example. You say that you don't need any specialist medical training for it.
Yeah, my understanding is I've not seen the test being used in detail, but my understanding is that the sample will be taken and put into a cartridge, which is then put into the piece of equipment. And so the whole point of these kind of approaches is you're moving away from a sophisticated laboratory, much closer to the patient and with much less sophistication. So I think that a basic amount of training would be needed, but I don't think it's anything more than you would need to, it's like something like using a microwave or using a piece of kitchen equipment.
Why was there a delay? Because other countries have already brought in these quick result test systems. Why was it that we didn't have them yet?
Well, actually, the company Oxford Nanopore, who are behind one of the kits, have really led the field in terms of rapid nucleic acid testing in the field close to the bedside. So I think the basic technology is something that we did lead on in this country. I'm not sure why it's taken this amount of time to reach this point. I know that some tests in general have been brought in and then they've been found to not be up to the mark and so they've had to be withdrawn. I imagine with this one, people wanted to be absolutely sure it was working properly.
And Tom, we know that there are certain parts of the UK, the Manchester area, for example, where there are concerns about the rise in number of coronavirus cases. When you look at that, how concerned are you about what's happening there?
Well, I don't think there's any doubt that now, as we've eased lockdown, the number of cases is slowly starting to rise. And it's happening in Manchester, it's happening in other parts of the country. And so we have to make rapid decisions about how we're going to stop this happening. And in Manchester, they've taken decisions about reducing contact within the house because this seems to be where a lot of the transmission's occurring. But we're going to have to make these kind of decisions across the whole country over the coming weeks and months. But one of the things that will help us is the ability to very quickly diagnose individuals and identify all their contacts and shut down on that. So these kind of new technologies will assist with that.
And in terms of the what there has been a lot of discussions about various terminologies around this, the second wave or a second spike in cases, and politicians are looking very much towards Europe and what we're seeing there. How do you see that scenario?
Well, we're seeing increasing cases in Europe, and I think it's a bit of a distraction to be too concerned about this idea. I've heard talk of a second wave coming from Europe. We don't really need anything to come from Europe. We have our own virus, our own cases in the UK, and as lockdown eases, those are going to increase. So we have to do things locally to stop that happening. I think you only get a second wave if you don't do anything about the cases that you are discovering. And we are now doing things about the cases that we're discovering. We're having to reverse some of the easing of lockdown, and we're having to implement measures. So, and I think this is going to be the pattern over the next few weeks and months. We're going to see increased cases. As long as we can react locally, that will stop a bigger outbreak across the whole country.
Professor, thank you very much for your time once again this morning. That's Professor Tom Solomon, who's from the University of Liverpool.